Hello friends. Today we are going to discuss about course and outcome of attention deficit hyperactivity disorder. I am Dr. Suresh Badadmat, Professor of Psychiatry working at NIMHANS, Bangalore. In this video, I'll be discussing about the course and outcome of ADHD, what is the impact of ADHD on various aspects of patients suffering from ADHD, what is the economic burden of ADHD. As you know, earlier ADHD was considered to be only a childhood disorder. Now the scientific community has established beyond doubt ADHD being a neurodevelopmental disorder. It is a lifelong suffering or a lifelong disorder. Here, children with ADHD they do not just outgrow ADHD symptoms. Invariably, many of them continue to suffer even in their adulthood. It affects many dimensions of life. Invariably, as ADHD presents in children with difficulty in paying attention and concentration, hyperactivity, difficulty in controlling their impulses, and emotional dysregulation. If you look at the prevalence of ADHD in the community, 5 to 7% of the children suffer from ADHD, and 2 to 2.5% of the adult continue to suffer with ADHD. The numbers are huge. If you even consider 2 to 2.5% of the population suffer from ADHD in adult, if you look at the Indian population, it is 140 crore. And if you consider 2 to 2.5%, that means we are talking about 3 to 4 crore of population suffering from ADHD. Now let's understand what is the course and outcome of this ADHD. Why should we understand about course and outcome? Based upon the course and outcome, you will be considering whether we should give medication, whether we should give psychotherapy, or else combination of both, how much it affects the life of a person who is suffering from ADHD. Recently, there was a publication by Arthur K. and his colleagues in 2016 in Current Psychiatric Report. The title of the study was Lifespan Studies of ADHD, that is, conceptual challenges and predictors of persistence and outcome. In this study, the estimate of ADHD persistence into adulthood was studied. That means they had followed up the children who have been diagnosed with ADHD. How many of them continue to have adult ADHD? So in this study, they found that some of the study reported 5% only. At the same time, on the other end of the spectrum, 76% of the patients continue to have ADHD symptoms in the adulthood. That means there is a huge range from 5 to 76% of the children who are suffering from ADHD will continue to have symptoms. One, it is the presence of symptoms. Other one is presence of complete ADHD diagnosis. This wide range from 5 to 76% has been attributed to the methodology of the study, what kind of scales were chosen, what was the definition of ADHD, what are the scales used, what is the caseness of ADHD, whether subsyndromal diagnosis of ADHD were considered, whether hyperactivity was considered as one of the important symptoms when they had followed up, and also what were the other diagnostic procedures introduced. Since there is a varying degree and also earlier diagnostic categories, either you take DSM-5 or else ICD-10, usually did not recognize adult ADHD. They continue to believe ADHD is only in children. And only in the past 1 decade, we are able to establish ADHD is there even in adult. Hence, with this limitation, these studies reported 5 to 76% of them continue to have ADHD. Previous meta-analysis have clearly indicated 15% of the diagnosed children continue to have full ADHD diagnosis, and 65% of them will have subsyndromal diagnosis of ADHD. The reason being the subsyndromal is, as the person becomes adult, from the age of 18 to 25, the brain maturation occurs. Invariably, the hyperactivity decreases. However, inattention and impulsivity in certain domains continues to exist, and emotional dysregulation continues to manifest. If you consider only the hyperactivity, invariably ADHD diagnosis becomes subsyndromal. It is based on the diagnostic criteria. This range varies. At the same time, these studies also looked into what are those predictors which indicates the child who has been diagnosed with ADHD will continue to have symptoms even adult. The available literature at this point of time indicates if there is a severe ADHD or else comorbid conduct disorder or personality disorder, or also if the patient has comorbid major depression and poor compliance for medication, all these indicated that means the child is going to develop adult ADHD. So these comorbid conditions, severity of the illness, and compliance for treatment indicates whether the child is going to have adult ADHD or not. Further, comorbid conduct disorder in male patients also strongly predicted early death, substance use, conflict with law, and getting arrested. So these are the predictors have been found to be very robust predictors with regard to ADHD and criminality and development of adult ADHD. Similarly, Karma et al. In 2015 reported an important study, that is persistence and remission of ADHD during adulthood, a 7-year clinical follow-up of studies. Here, they had recruited 344 children who have been diagnosed with ADHD, and they had followed up, and the follow-up rate was very good. It is up to 65%. That means they were able to catch up 227 patients, and they have examined when they became adult. Approximately only third of the sample, that is 70 patients, invariably 30%, remitted from ADHD. That means remaining 70%, that is 2/3, continued to have symptoms. That means we are talking about 2/3 of the adult continue to suffer from ADHD. So this is an important study which indicated that ADHD continues to be in adulthood. What are those important predictors in this study indicated? Again, baseline severity of ADHD symptoms. That means if the child had a severe ADHD, add oppositional defiant disorder, or also it may be conduct disorder, and social phobia predicted the presence of adult ADHD. That means persistence of symptoms. And hence, we can conclude follow-up studies have reported a divergent results from 5 to 79% at this point of time. Presence of 79% means we are dealing with adult ADHD. However, some of the studies have reported up to 55% continue to have adult ADHD. Overall, you can consider 50 to 60% of the childhood ADHD continues to have symptoms even in the adulthood. But again, various meta-analyses have clearly indicated inattention indicated or strongly associated with academic impairment. That means they will not be able to pass exam, they will have low self-esteem, negative occupational outcome, and poor adaptive functioning. That means if the child has inattentive type of ADHD subtype, these are the problems they will face. If the child has hyperactive and impulsive types, subtype, in such a scenario, those children will have peer rejection, aggression, risk-taking behavior, accidental injury, and these children will end up with early mortality. So the combined type of subtype ADHD will have combination of this outcome. So these are the early predictors of course and also outcome in ADHD. Now let's move into the second important impact of ADHD on various aspects of patients. One of the landmark study I would mention, this is the World Federation of ADHD International Consensus Statement of 208 evidence-based conclusions. I request all my viewers to go through this Farun et al. Study. This is basically summarized all meta-analysis, systematic review with regard to ADHD. This is one of the finest article which I have found, and I am summarizing this article in the further video. Let's look into what is the impact of ADHD on physical health. As you know, ADHD patients are very hyperactive. So you believe ADHD patients will be very thin. However, the data is contrast. The data says, especially from meta-analysis from 12 studies covering 180,000 participants, indicated that unmedicated ADHD were about 40% more likely to be obese than the counterpart normal children. That means ADHD patients who are not treated will become obese over a period of time. Especially in children, unmedicated ADHD had 20% chances of becoming obese. In adult patient, it is 50% if they are not treated. That means ADHD can be considered as the one of the risk factor for obesity, or it may be vice versa. But currently, the data is preliminary. We need to consider prospective studies thoroughly. Let's look into the diabetes mellitus. Taiwan National Health Insurance Research looked into adolescent and young adults with ADHD. They found that the ADHD patients had 3 times more likely to develop type 2 diabetes. Further, prevalence of type 2 diabetes was 70% greater in adult with ADHD. That means this risk increases even adult. A retrospective analysis of 650,000 children and adolescents in Germany with ADHD found that 40% more likely to be diagnosed with type 1 diabetes. That means diabetes mellitus is going to be very common in adult ADHD and also children with ADHD over a period of time. And whereas one of the other important study which was reported by Akamoto and his colleagues, this was a study done in German's youth. It looked into 2.5 German youths, and they looked into other physical comorbidities and ADHD. And this study clearly said that the children and young adults who are suffering from ADHD had 9 times more likely to develop metabolic disorders, 5 times likely to develop viral pneumonia, 4 times white blood cells disorder, 3 times the chances of developing kidney failure, high blood pressure, or being obese, 2.5 times risk of developing diabetes mellitus or migraine, and twice likely to develop asthma or autoimmune disorder like atopic dermatitis. That means ADHD does not only impact mental health, it also impacts physical health. Not only that, the studies are indicating ADHD patients are high risk of developing or meeting with accident. A meta-analysis of 16 studies encompassing 175,000 people estimated after controlling for various factors like mileages of driven car, they indicated the person who is suffering from ADHD, there are 23% more likely to be involved in vehicular accident. That means when you recruit a person, please check whether he has ADHD or not. If he has ADHD, there is high likely chance of him meeting with an accident. Further, a meta-analysis of 32 study covering more than 4 million people found that ADHD had 40 to 50% greater risk of accidental physical injuries. Not only that, even in children who are suffering from ADHD, there is high chances they will meet with an accident and present in pediatric emergencies. These are all regarding accidents, obesity. What about mortality? Whether ADHD patients has high mortality? A cohort study of 2.2 million in Taiwanese found that ADHD had twice the rate of suicide, twice the rate of death by homicide, 30% great rate of death from unintentional injury. That means ADHD has higher mortality rate. This mortality rate can be because of ADHD developing depression, unable to successfully be in education, job, depression, substance use, of course, suicide. At the same time, ADHD patients being impulsive, overactive, and suddenly becoming angry may end up in conflict with law. Sometimes they may end up having conduct disorder or oppositional defiant disorder, and these people may be killed, that is by homicide, and further unintentional injuries can also cause death. As I mentioned earlier, Taiwanese studies of 20,000 adolescent and young adults with ADHD on comparing with normal children, 4 times they are likely to attempt suicide, 6 times likely to repeat attempt suicide. So, my dear friends, please remember, if you have a thought whether you should treat your child with ADHD with medication or therapy, think about this outcome. There is chances of high suicidal attempt and repeating suicidal attempt and completing suicidal by death. And the studies are also indicating long-term methylphenidate treatment, that is stimulant, decreases the attempt to suicide and suicide, death by suicide. Let's look into ADHD and conflict with law. Meta-analysis comprising 21 studies, over 9,500 prison inmates found that prevalence of ADHD in prison inmates was 20% more. So that means the people who are going to be arrested invariably will have ADHD and comorbid conduct disorder or antisocial personality disorder or substance use. Similarly, a meta-analysis reported the prevalence of ADHD among adolescents in juvenile detention center had 17% more compared to normal adolescents. So, my dear friend, please remember this. ADHD can bring in conflict with law. Further, victim of crime. Children with ADHD were 2.7 times more likely to be victim of violent crimes than normal children. Similarly, a Danish registry, a nationwide population study of 675,000 youths, found that youths with ADHD were 3.7 times likely to be reported undergoing sexual violence. So that means ADHD children not only be in conflict with law, at the same time, some of the patients may require support and they may be the victim of crime. Now, after discussing about the physical health, now move into mental health. The quality of life. Meta-analysis of 17 study comprising from 647 families, over 2,300 participants evaluated the quality of life of parents whose children had ADHD in comparison of parents who did not have ADHD. And this study clearly said that quality of life of parents who are having ADHD children was very poor. Similarly, ADHD and bullying. Children and adolescents with ADHD were 2.4 to 2.8 times likely to engage in bullying. That means they may be the perpetrators. Similarly, a recent meta-analysis of 12 studies with over 1,900 participants found that adults with ADHD had very elevated levels of emotional dysregulation compared to normal population. That means adult ADHD will have irritability, sudden emotional dysregulation, becoming violent is common. Let's look into the academic underachievement. A study from US sample, almost 30,000 adults, found that those with adult ADHD twice likely not to be graduated, that means drop out from school, and since they are drop out, they may not be able to engage in meaningful employment. Further, a meta-analysis of 10 studies including 830 youths, found that ADHD was strongly associated with poor performance, especially with regard to SLD, that is expressive, receptive, and pragmatic language. That means ADHD children has SLD, poor academic performance, and of course, which results in poor job or occupation. A nationwide cohort study of 750,000 Scottish school children reported that children with ADHD were twice likely to be dropped out of the school compared to normal kids, 8 times likely to be reported by the teacher that these children requires special assistance, 50% more chances of getting injured, and 40% more likely to be they are unemployed. Not only that, teen pregnancy. Studies have found that children and adolescents with ADHD were more likely to have teen pregnancies. And studies have talked about 2.7 million girls from Denmark. Studies clearly indicated teen pregnancy is very high, even in Sweden and Taiwan. So, children with ADHD, especially in females, teen pregnancy is common. So please remember this. Not only that, substance use disorder. Meta-analysis of 11 studies with almost 2,400 participants, those with ADHD were 50% more likely to develop drug abuse or alcohol abuse, and it is twofold greater than the normal population. That means substance use is a risk category for children who are suffering from ADHD. A Swedish study of over 500,000 of people found more than threefold association with ADHD and drug abuse. So, drug abuse is a big problem already, and ADHD children or adult with ADHD will be suffering from not only with ADHD but also substance use. Further, ADHD also increases risk-taking behavior. A study of over 36,000 people from US reported that ADHD increased the risk of problems such as gambling, spending too much money, reckless driving, quitting job without thinking. That is impulsivity. So, risky behavior is another biggest problem with children with ADHD and also adult. With all these problems like physical health, mental health, mortality, morbidity, what is the impact on the economy? The economy impact is not only on the patient, patient's family, community, organizations who are hiring this ADHD person, and also nation at large. Studies have clearly said that, which looked into 7,000 workers in 10 nations, found that ADHD had an average of 22 annual days of lost performance. Think about this. Imagine a person who is there and loss of 22 days. Healthcare cost. A nationwide cohort study of 445,000 people in Swedish National Register compared healthcare cost of 3 groups. What are those 3 groups? First, childhood ADHD with persisted into adulthood, those ADHD who have remitted into adulthood, and those who never had ADHD. They compared these 3 groups and what is the healthcare cost. Those who never had ADHD, the average annual healthcare cost was 304 pounds. If they had ADHD in the past and currently remitted, then the cost increased by twice. If they had ADHD and now also in the adulthood, they continue to have ADHD, then the cost tripled. That means the cost increases with ADHD. Further, the National Health Insurance Services of South Korea claims that total annual economic burden due to ADHD across the nation was $47 billion. A systematic review of 19 US studies found that ADHD was associated with overall national annual cost of $143 to $266 billion to the nation. Further, cost borne by family members of people with ADHD ranged from $33 to $43 billion, my dear friends. Let's look into the health insurance cost per person. German health insurance records, including 25,000 patients with ADHD, indicated that patients with ADHD roughly costed 1,500 pounds more annually than the person without ADHD. That means it increased the premium. Presence of comorbidities such as mood disorder, anxiety disorder, substance use disorder, obesity, personality disorders significantly increased the cost. The additional cost required because of comorbidity was 2,800 pounds, my dear friends. So look at the cost per person. And to summarize, my dear friends, untreated ADHD and impact on various domains of life: physical health, mental health, mortality, morbidity, and also economic burden. Clearly indicated impaired quality of life, poor relationship, early divorce, reduced employment, vulnerability for addiction, depression and anxiety, teen pregnancy, increased sexual transmitted diseases, conflict with law, rash driving, meeting with accident, premature death, and suicide. To conclude, my dear friends, ADHD is a lifetime neurodevelopmental disorder requiring lifetime care. Prevalence of ADHD in children is 5 to 6%, and in adult it is 2 to 2.5%. Most of the time, ADHD in adult is underdiagnosed and untreated. This increases the economic burden on the nation, on the community, and also to the family. ADHD has a serious impact not only on the person, on the family, and as a community overall. Early identification and treatment is the only way for the ADHD patients. Untreated ADHD patients can have a severe adverse consequences in their life, not only on them, but also on the community. ADHD costs society hundreds of billions of dollars every year. So, one of the scientists has said that ADHD is the costly childhood disorder at this point of time, my dear friends. So this is the course and outcome and impact of ADHD on various domains of life. Thank you very much for your valuable time. Stay safe.